So the next couple of techniques that we're going to do are muscle energy techniques for either anteriorly or posteriorly translated ribs. So if we know that somebody's having a positional fault with those ribs and maybe is having some difficulty with inhalation or exhalation as they're breathing, or if they just have some postural abnormalities, maybe like a rounded shoulder, or they've fallen on an outstretched hand and we notice that a rib is translated posteriorly, we can use this muscle energy technique to kind of help reset that rib or try to get it into a better alignment to give those muscles a little bit more of a mechanical advantage to do what they need to do. So very simple technique. It just depends on which way that rib is translated. So if we're going to go through both anterior and posterior. So we'll start with posteriorly translated rib. So what we're going to want to do is with one hand, we're going to be providing a force on that rib to kind of help maneuver it back into the position that it needs to be. And then with our opposite hand, we're going to be kind of resisting that activation from the patient. And we're going to be using the patient's musculature basically to help assist us in resetting that rib. So if we have a posteriorly translated rib, what we're going to be doing is we're going to be pushing in an anterior medial direction through the junction of that rib and thoracic spine. And then because it's posterior, we want to have him activate the anterior musculature to kind of help pull that rib forward. So what we would do is we would palpate along that T-spine, find where that rib might be. He doesn't have one, but we're going to pretend that he does. So my force is going to be kind of anterior medial through that opposite shoulder. So I'm going to use my thumb, provide that force. He's going to bring his arm up into abduction. And then what I'm going to do is I'm going to place my hand on the inside of his arm here. And he's going to basically be going into horizontal adduction. So we're providing that force. He's going to go ahead and resist for 3 to 5 seconds. And then relax. And go ahead. And relax. And each time I'm kind of giving a little bit more of a translation on that rib through that opposite shoulder. And one more. And relax. So we would do 4 to 5 repetitions of that. We might follow that up with a stretch or maybe one of the manipulation maneuvers that we've talked about. The opposite way is if we have an anteriorly translated rib, we're going to be providing just a lateral force this time through this actual shoulder, and then he's going to be activating his rhomboids and middle trap, trying to come into some horizontal abduction to kind of help reset that rib in a posterior direction. So again, here, we're here through the same shoulder, and then he's just going to be pressing out against us. And relax. And relax. So again, for a posterior translated rib, we're trying to go anterior medial with a activation of the anterior musculature. Posterior or anteriorly translated rib, we're going anterior lateral with the activation of the posterior musculature.